You've probably heard people talk about a bad kid, right? But what happens when that kind of challenging behavior goes way beyond a phase and turns into something persistent, something that really causes harm? Well, today, we're going to dive into the really complex and often misunderstood world of conduct disorder to figure that out.
Look, every kid acts out. They break rules, they get defiant, they push boundaries. It's kind of part of the job of being a kid. But where exactly is the line? When does typical misbehavior stop being typical and become something far more serious? That question right there is the heart of what we're talking about.
So, to really get a handle on this, here's our game plan. First, we'll nail down what conduct disorder actually is. Then, we'll look at the key things that put a kid at risk. We're also going to explore its really important connection to ADHD. And finally, we'll talk about what the future can look like. The prognosis and how it's managed.
All right, let's get right into it. To really understand conduct disorder, you have to push past simple labels like bad behavior and look at what the clinicians are seeing.
Okay, so this is the absolute core of it. The key phrase here is a persistent pattern of behavior that violates the basic rights of others. We're not just talking about being defiant or not listening to your parents. This is a consistent pattern of aggression, destruction, or deceit that causes real, actual harm to other people or property.
And this is the critical difference between conduct disorder and something you might have also heard of, oppositional defiant disorder, or OD. With OD, you get a lot of arguing, a lot of hostility toward authority figures, but conduct disorder takes it to a whole other level. It's about actively violating someone else's rights and safety. That's the line. That's what gets crossed.
And here's something that might surprise you. You'd think impulsivity would be a central part of the diagnosis, right? But technically, under the formal ICD-10 criteria, it isn't a required feature. Sure, a kid might be impulsive, but the diagnosis really hinges on that persistent pattern of violating the rights of others.
So, a pattern like this doesn't just pop up out of thin air. It grows out of this really complicated web of different influences: environmental, social, and personal. When you dig into the research, a few things really stand out. For example, parental criminality is a factor, which could be a mix of genetics and learned behaviors. We also see it more often in lower social classes, which really highlights the powerful role that things like environmental stress and a lack of resources can play. And this last one, it's just fascinating: untreated dyslexia. Imagine the constant frustration of failing at school day in and day out. That frustration and anger can build and build until it spills out in other, much more destructive ways.
Now, it is pretty much impossible to have a serious conversation about conduct disorder without bringing up another major player that's often on the scene. Clinicians call this comorbidity.
And the condition it partners with most often, by a long shot, is ADHD. When a kid has both of these conditions at the same time, it creates a much tougher situation for absolutely everyone. The child, the family, the school. It just complicates everything.
So just how big is this overlap? Well, the numbers are pretty staggering. It turns out that about 1 in 4 kids who are diagnosed with ADHD
also has conduct disorder. This chart really drives it home. That 25% slice represents a huge group of kids who are dealing with a double whammy, not just the challenges of ADHD, but also the severe behavioral issues of CD. And that makes finding effective treatment absolutely essential.
Okay, so given all this complexity, what does the future actually hold for a kid with conduct disorder? Let's talk about the path forward, what we know about prognosis and management.
One of the single most important things to know is this: time is a huge factor. The earlier these severe behaviors start, the tougher the road ahead is likely to be. And that's exactly why spotting the signs and intervening as early as humanly possible is so critical.
Now, when we talk about management, and this is super important, it's not as simple as just writing a prescription. Medication is not the first thing you reach for. And while powerful drugs like risperidone might sometimes be used for severe aggression, they are absolutely not a core part of the treatment plan. The real work is in targeted therapy and behavioral interventions.
And the stakes for getting this right are just enormous, not only for the individual, but for society as a whole. The research is clear. When we effectively treat conduct disorder in kids, it has been shown to reduce rates of violence later in life. It can literally change the entire trajectory of a person's life.
So all this leaves us with one last big question to think about. We just saw that something like untreated dyslexia, a struggle in the classroom, can be a risk factor. So if academic problems can actually feed into severe behavioral disorders, where should we be putting our focus for early intervention? Maybe, just maybe, one of the most powerful first steps we can take isn't in a clinic, but right inside our schools.